Hello children, I hope that you all are doing fine. I welcome you all to our special English hour. Here we learn lots of new things, and while learning these things, we also have fun. Are you ready for some fun? Let's get started. Today we are going to read a lesson called Revolutionary Steps in Surgery. We all know science has played a very important role in the development of humankind. Right from the invention of steam engine to today, how we are able to connect the entire world together. Science has helped humankind evolve and grow. Along with that, medicine has also seen many changes. In ancient times, performing surgery was very difficult because we did not have equipment or the required knowledge. There was experimentation which was going on. The changes that we see today with different types of doctors who specialize in different areas has only been possible because of the advancement in science and technology. So today, let's study about this. Children, before we read today's lesson, let's learn some new words. You will see these words in the lesson when we read it. So I request you to please make a note of these words in your notebooks. Anesthetics. 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 He was given anesthetics before the surgery. Extraction. 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 I had gone to a dentist for an extraction of my tooth. Neurosurgery. 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 Neurosurgery is a very complicated surgery. Revolutionary. 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 Steam engine was a revolutionary invention. Utilization. 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 Utilization of solar energy can help us in saving our planet. Tumor. 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 There are two types of tumor. So children, today we learned 6 new words. Let's revise them. Anesthetics, extraction, neurosurgery, revolutionary, utilization, and tumor. I hope that you remember these words, and I hope that you have made a note of these words in your notebooks. Now, let's read a story from our Bal Bharati textbook. Please open page number 82 of your textbook. Now, I will be reading this lesson, and I request you to point at the words as I read them. And if you don't have a textbook, listen to me carefully. Surgery date back to as early as 600 BC. Sushruta Samhita is one of the oldest works in the world dealing with surgery. It indicates that Sushruta was probably the first surgeon to perform surgical operations or plastic surgery. Later, some ancient surgeons performed tool extraction and bloodletting. Major surgery could not develop for centuries because of lack of knowledge and technology. The doctors had to cut open the part of the body that was not healthy, remove it, or set right that part. This would involve a lot of pain to the patient. General anesthetics like ether or chloroform developed only from mid-19th century, making painless surgical operations possible and successful. Surgery is a very old concept, as old as 600 BC. Sushruta is said to be the oldest surgeon in the world. He wrote the book Sushruta Samhita, and in this book you can find references of procedures to perform surgery on animals. Later, some other surgeons tried extraction of tooth or removal of tooth. In those days, surgery was very difficult because people did not have enough knowledge or equipment. Today, surgery can be performed using lasers, but then people had to remove part that was affected or needed to be cured. That part was replaced or treated. Today, if anyone goes under surgery, he or she is given anesthesia, because of which we do not feel pain. But in olden days, there was no anesthesia, which is why surgery was very, very painful. Modern techniques are used nowadays for anesthesia. General anesthesia benumbs the whole body, and it is used for surgery on any region of the body. For local anesthesia, local anesthetics are injected into the surgical spot or an area near the nerves. Over the years now, revolutionary steps have been taken in different types of complicated surgery, and these have made such operations successful. Today, when surgery is performed, local anesthesia is injected on that part where surgery needs to be performed. For example, if I have a wound on this part of my hand and something needs to be removed, I will be given local anesthesia here because the surgeon will be operating on this part of my body, and that could cause me pain, which is why we give anesthesia, because we don't feel pain and the operation is successful. Let us start with cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctors did not have modern medical tools and procedures essential for heart surgery. In those days, heart patients were treated with sedatives and they usually did not survive. Then, in 1893, Daniel Hale Williams, a young African American surgeon, attempted a new medical technique in order to save a patient's life. Children, let's talk about heart surgery. Can you imagine how important of an organ is our heart? It is very important. But as I said, in those days, anesthesia was not available, which is why anytime heart surgery had to be performed, the patients were given sedatives. Now, what are sedatives? Sedatives are pills that make one sleepy. So these patients used to go to sleep and then the doctors would perform surgery on them. But most of the times, these patients ended up dead. But in 1893, Daniel Hale Williams, who was an African American surgeon, brought about a change. He thought of using a new technique. Let's find out what happens next. A patient, James Cornish, was suffering from a very serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, the sac around the heart. Dr. Williams, with 6 staff doctors, performed a complicated and daring operation. Dr. Williams became the finest surgeon to save his patient by successfully repairing the human heart. The name of the patient was James Cornish. He had a stab in the heart. The wound was a few inches away from the heart, and this looked like a very complicated procedure. But Dr. Williams became the first doctor to have treated and mended the heart of a patient. Now, many more advanced techniques are used in this specialty to deal with heart complications. Open heart surgery, which can help to repair heart defects, heart valves, and even replace them, is also performed successfully. With proper measures, patients can recover from cardiac surgery faster than they did before. Neurosurgery is another recent specialty to have received recognition since the early 1900s. It is concerned with the treatment of disorders of the nervous system. Neurosurgeons operate on the brain, the spine, or nerves. They can treat patients of all ages, from the newborn to the elderly, who have suffered a stroke. Today, there are many new techniques to treat heart. These include treating heart or even replacing them. Now, let's talk about neurosurgery. This has evolved from 1900s. Neurosurgery deals with problems of brain, nerves, and the spine. Harvey Cushing is considered to be the father of modern neurological surgery. In the early part of the 20th century, he developed basic techniques and instruments for operating on the brain as a distinct surgical specialty. Cushing dramatically reduced the mortality rate for neurosurgery from 90% to less than 10%. By the time of his retirement in 1937, he had successfully removed more than 2,000 tumors. The main reason that mortality rates had been so high before was blood loss. Among Cushing's significant achievements are the methods he developed to stem this blood loss by inventing a clip called silver clip or Cushing clip. Thus, neurosurgery is one of the most cutting edges in the world of surgery and medicine. Henry Cushing is known as the father of neurosurgery. He mainly developed new techniques and instruments that are required for performing surgery on the brain. Before Cushing, 90% of people who went under neurosurgery could not survive. But after Cushing, the mortality rate came down to 10%. In 1937, Cushing retired and he had cured tumor of 2,000 people, which is why he is known as the father of neurosurgery. When people used to undergo neurosurgery, the main problem was the loss of blood, and Cushing created instruments that could stop this. Today, neurosurgery is cutting edge in the market of surgery. What is robotic surgery? Robotic surgery is a type of minimally invasive surgery. Minimally invasive means that instead of operating on patients through large incisions, use is made of miniaturized surgical instruments that fit through a series of quarter-inch incisions. When performing surgery with Da Vinci, the world's most advanced surgical robot, these miniaturized instruments are mounted on 3 separate robotic arms, allowing the surgeon maximum range of motion and precision. The Da Vinci's 4th arm contains a magnified high-definition 3D camera that guides the surgeon during the procedure. The surgeon controls these instruments and the camera from a console located in the operating room. Placing his fingers into the master controls, he is able to operate all four arms of the Da Vinci. While looking through a stereoscopic high-definition monitor, the robot literally places the surgeon inside the patient. This gives him a better, more detailed 3D view of the operating site than the surgeon's eye can provide. Every movement he makes with the master controls is replicated accurately by the robot. When necessary, the surgeon can even change the scale of the robot's movement. If he selects a 3:1 scale, the tip of the robot's arms will move just 1 inch for every 3 inches that surgeon's hand moves. Utilizing this advanced technology, our surgeons are able to perform a growing number of complex surgical procedures. Since these procedures can now be performed through very small incisions, our patients experience a number of benefits compared to open surgery of the past. Robotic surgery is a surgery in which miniature tools are used. Along with that, it is performed using smaller incisions. What are incisions? Incisions are cuts that are on the body which the surgeon has to make to perform a surgery. So instead of doing bigger cuts or bigger incisions, robotic surgery uses small incisions. Along with this, there is the Da Vinci, which is a robot, and he is the one who guides the surgery. It has 4 arms, and this Da Vinci is the one who performs the surgery. However, all the controls are in the hand of a surgeon. Along with 4 hands, it also has 3D camera, which gives a complete view of the patient's body to the surgeon, which makes it even better for the surgeon. This is the most advanced form of surgery today. This advancement has helped doctors and patients all over the world. This is better than open surgery. When surgeons used to perform open surgery before, the patients, even after getting cured, faced many problems. But because of smaller incisions, the surgery becomes successful and there are no side effects later on. So children, in this lesson, we saw how the process of surgery has evolved through time. This lesson talks about what were the difficulties that people used to face when the process of surgery started, and now how through advancement in science and technology, surgery has become easier and it helps the patients as well. Children, I hope you had fun in today's session. Today, we learned many new things. We learned about different types of surgeries, about different types of doctors and what they are called. I would like to end this session with a quote. This quote is by Dr. APJ Abdul Kalam. Science is the most beautiful gift given to mankind, and we must not distort it. I will see you all in our next session. Until then, take care and stay safe. Bye-bye.